I am going to be talking a little bit about the science of the map, but also how that science is interpreted by the public or your consumers. So how do we communicate the risks that the map is defining for us in this industry and with the consumer in a way that builds public trust? And there's some nuances to that. So our objectives today is to understand not only the science, but the psychology of risk perception, and learn to apply the rules of responsible risk communication and identify the utility of the WQA contaminant occurrence map for consumer risk communication. I think the key take-home point here is that the map is a great educational tool. You have to be very careful that it doesn't become a scare tactic. So that's what we're going to talk a little bit more about. So we all have subjective judgment in terms of risk perception. So this figure shows the public outrage, which is really the misplaced perception or the emotion around a particular hazard versus the actual hazard. So the size of the bubble is the relative relationship between our emotions and the facts of what that hazard can cause. And so the classic example here, and Peter Sandman, by the way, is a professor that came up with this concept a very long time ago, probably 70 years ago, and he basically said that risk perception and risk communication has to not only consider the hazard itself, the true facts of what the risk is, but also the outrage factor, which again is our subjective judgment. That's our emotions around what that risk actually means. And there's a lot of psychology to why we have these misplaced perceptions. The classic example again is we're more afraid of traveling in an airplane. We're more afraid of traveling in an airplane than we are of driving a car, even though our actual risk of something bad happening is more likely to occur if we're driving a car, not an airplane. So how do our communities actually see risk? And by community, I'm really talking about your consumers. How does the general public really see risk? And the emotions of risk are really driven by a couple of factors. In particular, if the risk is imposed on us and not voluntary, then we see it as riskier behavior or a riskier imposition on us. So the classic example of that is we will fight hard to make sure the new factory that's creating potential pollutants into the air doesn't come into our community, but maybe we smoke a pack or 3 cigarettes a day. So that's a misplaced perception of risk. Other examples, artificial versus natural risk. If arsenic in your water comes from a natural source rather than some industry in the area, it's more accepted. There's less outrage and emotion around that. And you can kind of go through this list of other things. If the risk seems unethical or unfair, people are more upset about it. If it's a memorable event, like 9/11. We spent a lot of money in the United States preventing the next terrorist attack, when statistically a terrorist attack is not the most likely way you're going to meet your demise, right? So, but memorable events are something that we want controlled. We want somebody to take charge and control them for us because we have emotion around that. Exotic risks. So this is a picture of a Brazilian banana spider. And this little guy has shut down entire shopping plazas. I don't have time to go into the full story. Look it up, Brazilian banana spider. But this is what we would call an exotic risk, something very rare that could occur, but people were really outraged about this showing up in bananas in our supermarkets. Dreaded risk, again, these exotic events. Ebola would be an example of a dreaded risk. We spent a lot of money controlling Ebola, the Ebola outbreak, which really never occurred. The good news is it helped us prepare for COVID, which was coming a couple of years later. But in the US, we only had a few cases of Ebola and I think 1 death, and we spent a lot of money learning how to control that epidemic or pandemic that never really happened. So there's, the greater number of factors related to these outrage triggers, essentially, the greater the public concern of risk. And how this relates to our topic today is that you don't want to feed into what might already be a public bias about water quality. So your consumer might already be very concerned about their water quality, or they might not be concerned at all, where that's where the bubbles are sort of misplaced in our subjective judgment. So it's your job as the dealer to educate the consumer in a way that's really accurate and honest so they can make informed decisions to control their risk. And that's how you build trust. So this is my last example on this slide, and I just find this really funny. And some of you probably ride motorcycles, maybe you choose not to wear a helmet, but look how padded the knees are in this picture. So to me, that's misplaced risk perception. You know, my knees are safe, but what about my brain? I don't know. Okay, so why should you be concerned about risk perception? Because the public perception of risk will influence their decision, and it also influences policy. We've heard a lot this week at the meeting already that this industry has a strong influence on regulatory agencies. They're looking to you for guidance, for solutions to mitigate things that your municipality can't always control. So we want to make sure people are honestly educated, that you're educated in a way that you can share that information and drive effective policy. So misperceptions about risks create poor decisions, and they create poor policy. And those perceptions can be changed through effective risk communication. It needs to be ethical, honest, and that's how, again, you build trust. So who does the public trust? To a large degree, they trust the media, and the media really only gets their information from the industry or from the regulators. So they're getting information from other people and trying to communicate that to the public. So you should be a source for your media, your local media, making sure there's an understanding, a partnership about the problems in the community and the solutions in the community. In general, though, the public doesn't really trust industry that has a goal for profiting in the situation. They also don't trust people who have potentially shared liability. So right now the CDC is having some risk communication issues because there's some wavering about what the policies should be, and that's because we largely have a big gap in science to support effective decisions and effective risk management. So that's something we will always balance, but the pseudoscience, the fake science messages, social media where people can take the information that they've gotten from somewhere, may or may not be accurate, and then it's like the telephone game. It just starts to get communicated, and misperceptions can spread like wildfire. These are things we have to be aware of and do our job to control it. And this is how we do that. So we need to recognize there is a disconnect between the consumer, the household POE user, the consumer, and our technical professionals and our regulatory agencies. There's not good communication between those entities. So the technical professionals would be the municipality. They're responsible for treating, testing, and communicating to the regulatory agencies, your state primacy agencies, the managers, I call them, of water quality and reporting. They're responsible for that communication, but it's difficult to get that to the consumer. And I think that's where this map can be a very useful tool. And you as the dealer can use that tool to bridge the gap of communication between the technical professionals, the regulatory agencies, and the consumer. So the lesson here is to really understand the tool, be educated about it so you can share that information and close that communication gap that's been identified. So some key characteristics of effective risk communication is that it's a dialogue with your customer. You must be educated about the issues, informed about what their concerns are, and honest in the delivery of your risk communication. And it's an ongoing process. You want to be a relational resource with your consumer so that when they do see things in the media, they can go to you as a trusted expert for the solutions. They want to be empowered to make decisions. Remember our list of outrage triggers? One of those was if the risk is imposed on them and they don't have empowerment to decide how to mitigate that risk. So your job is to really educate them about the solutions, about the problems, but in a responsible way. And you need to recognize your consumer's bias. You know, what's being said in the media in the community? Are they already coming from a place of fear, or are they coming from a place of maybe you know, just relaxed opinions where they need to be educated? Hey, this could be a problem in your community. You might want to think about how to mitigate this. So just to kind of summarize some of the things we've touched on, risk communication, effective risk communication means that you're explaining the risks accurately, you're alerting consumers to the issues, but in very productive ways. If you've had a conversation with the consumer and that conversation ends with increased tension instead of tension reduction, then you haven't done a great job at your risk communication. You should make the consumer feel more comfortable. If they're coming from a place of fear, you have solutions that can help with that. If they're coming from a place of not understanding what the risks are, you've educated them and you have solutions for them as well. They feel empowered. That's the goal of your risk communication. You should be improving consumer perception and improving their ability to respond. And you want to increase the effectiveness of their risk management decisions. So our risk communication checklist has kind of these 9 components. So this is a slide maybe to save that you can share with your teams. These are our goals. The #1 goal is to build trust, and that's part of our process component. We want to be prepared for our audience. We want to be knowledgeable about the issues. The content components, we've talked about a lot of those. One thing I didn't really touch on is that #8, match your images to your content. So you might be saying the right thing, but what visual images are you sharing with your client? If you have a skull and crossbones on any flyers, that's probably bad risk communication. We've even found out if you use the color red in your messaging, red is like alert, alert, stop, something's wrong. And so we're even told when we're communicating with the public as a public health professional, don't use the color red. Don't use charts with red. That just alerts people automatically. We're conditioned to respond to certain image triggers. So be aware of what you're sharing, both verbally and with your written images. And then the final thing is the testing component. See what's working for your audience, because people are different in different communities. They have different cultures, different biases, different upbringings, and so they may have very different perception and subjective judgment triggers. So make sure you're revisiting and revising the way you're communicating with your public and responding to how they're responding to you. So my final slide here is to remind you to pay attention to those outrage factors. You don't want to be the person that escalates their emotions. You want to be the person that can calm their emotions. And you want to know about the scientific variables. So the map is a little sciencey, but don't underestimate the public's ability or your team's ability to understand the science and communicate it. We've seen with the COVID-19 pandemic, people understand the science. They want to know the science. That helps them understand the situation and make better decisions. So don't be afraid to use the tool, even if it seems a little sciencey. One thing Kim didn't share was my team at the University of Arizona is working with WQRF, in turn working with the WQA contaminant map, to make the information more digestible, so that when you hover over some of the content in the map, you have the option of clicking on an infographic that really outlines what arsenic is, what the health risks are to the public, and then what are some of the solutions for removing arsenic from the water, like a one-page consumer-friendly infographic. So we're working to integrate that type of content into the contaminant map. So key communication points, the data is on your side, the science is on your side, because we know that the strategy of the water utility to comply with regulatory standards is a multi-barrier approach. There's multiple steps to treatment that are tailored to that particular water supply that's serving the community. And we know that POU and POE is a final barrier. And that's an easy sell in my mind. What the municipality produces, what happens to the water through the distribution system, or in the premise plumbing of your own home, contamination biofilm in your own plumbing pipes, we have a solution at the final barrier. That's an easy communication strategy that doesn't invoke fear. It's just part of the facts, part of the science. And remember that the key communication points is you're giving control back to the consumer. The consumer wants that control. That will build the trust with you, help them make good decisions. And these educational resources, you're an educational resource. So learn the information, use the map, share the map. The map can really help you. It has well-documented, scientifically cited backup information, and I think it's going to be a really great resource for this industry, and I'm happy to be a part of it.